Ebola is one of the latest outbreaks we have experienced here in the United States. There's a true issue in regards to the deadly outbreak due to the fact there is no true cure for this virus. As an emergency medical services person, one should be aware of some of the signs and symptoms that people may include. Some of the signs and symptoms that may appear range anywhere from 2 to 21 days after exposure to the virus. On an average, it's approximately 8 to 10 days that the symptoms are going to appear. Some of the symptoms that may appear include fever, severe headaches, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, unexplained hemorrhaging leading to bruising. And as far as the recovery period from the virus is concerned, it depends on a good supportive clinic, as well as the immune system that the person may have. Currently, one of the largest outbreaks of this virus affecting multiple countries is in West Africa. There are a smaller number of cases at the moment that are reported in other locations within Africa as well, and there are some single cases that are reported in Senegal. However, these are isolated cases and can be considered contained, and at the present moment, further spread to any other surrounding countries does not appear to be imminent. The CDC, as well as the U.S. government and their partners, are working alongside the World Health Organization and international healthcare organizations to ensure the deadly virus is not going to be spread any further. Unfortunately, the natural reservoir host for Ebola has not been found, and it is clear that scientists have discovered that there is a direct link coming in contact with animals, such as the apes and monkeys, that are the greatest risks in contacting the virus. When infection occurs in humans, the virus can be spread to others through either direct contact, for example, broken skin or broken mucous membranes, and through the eyes, nose, and in the mouth. It is understood that the virus is not spread through the air or water, nor contained in general food. On the other hand, in West Africa, there is a high rate of spreading this virus due to the fact of the handling of wild animals that may have been hunted for food or coming in contact with infected bats. At this time, research has indicated that there is limited evidence that mosquitoes or other insects can transmit the virus to people. Healthcare providers who are coming in contact with patients who have been infected need to understand that this is a deadly virus and can be spread quickly. People and patients are at the highest risk of getting sick because they're the ones coming in contact with infected blood, bodily fluids from others, and being exposed continually to those infected with the virus. Exposure can also occur within the hospital setting or the healthcare setting where professionals are not properly protected. In this case, a dedicated medical equipment cache, preferably one that can be disposed of, should be used by healthcare personnel in providing care for the infected patients. Much is in the normal strand of viruses that proper cleaning and disposal of instruments, such as the use of syringes, need to be disposed of properly. Without the proper sterilization of instruments, the virus is said to be continually transmitted and could be amplified within a designated region due to the contaminated instruments. The good news is that once people recover from the virus, they can no longer spread the virus to others within that community. Although the virus has been found within a given community, it is not known whether or not the virus can be spread through sexual contact. Healthcare providers must be willing to secure patients within a designated area in order to mitigate the risk factors of spreading the virus to other people that may be in the emergency department, for example. The exposure to blood, bodily fluids, along with direct contact during dead body management perhaps, and without proper protection, may lead to infection. Other issues that may arise from the epidemiological standpoint and some risk factors that may be involved for the healthcare worker is not using PPE and coming in direct contact with the bodily fluids, handling the patient for several hours and caring, and also coming in close contact with that patient for a long period of time. If the healthcare worker is not wearing the proper PPE during the treatment of the patients that are infected with this virus, the likelihood and the incubation period will increase in that healthcare worker and probably expose others to this infection. And there's a greater chance of others becoming ill within that facility. An example of this would be traveling in an aircraft with the person who may have come in direct contact with the person who has the virus. Finally, some of the non-identifiable areas that may arise when coming in contact with the person is the asymptomatic approaches that may be undetermined and the amounts of time as well. In an effort to combat this virus outbreak, careful hygiene must be practiced by washing hands with soap and water or the use of alcohol-based hand sanitizers, along with avoiding contact with any bodily fluids. Some of the other areas that may be included in the overall protection would be wearing proper protective equipment, minimizing the contact with bodily fluids, and if possible the avoidance of funeral or burial grounds or someone who has died from the virus if at all possible. And the total avoidance of facilities within West Africa where this virus has been spread amongst other patients. It is highly suggested that some of these safety measures be made possible. As well as the United States and monitoring professionals here healthcare-wise, we're looking at approximately 2 to 21 days for the incubation period. It is imperative that the exposed worker then make it known to the CDC as well as the World Health Organization that they have been exposed to people with these healthcare issues in West Africa or coming in direct contact with someone who has had the virus. Alerting health officials and regarding the outbreak are all good practices in order to contain this virus. On a positive note, the likelihood of contracting the virus in the United States is pretty low unless the person or healthcare worker has come in contact with the blood or bodily fluids from a person who has been infected with the virus. If the signs and symptoms are showing up early, medical services should be rendered and perhaps treated as such as pertaining to this virus. Although there is greater risk within the hospital setting for contracting the virus, there is still a chance EMS workers in the field are still presenting with some of the same challenges due to the uncontrolled nature of the work that is being done in the field. An example of this potential for access to this virus obviously are out in the field, handling the patient that may be already infected with the virus, and then needing to confine that patient to perhaps the ambulance for that general transportation. The EMS system and EMS providers need to be trained and educated on proper handling of any patients that may be infected with the virus. Proper PPE as well as establishing protocols need to be implemented, and it may be necessary for documentation and sterilization purposes that the ambulance will be included in such policies. The ambulance may need to be completely sterilized prior to going back out on the emergency event, and there will be a need for a coordinated effort between both the medical teams as well as the providers and the healthcare facility, and contacting the medical director within the community in order to create a comprehensive plan and a comprehensive approach for minimizing the exposures to the virus. There may be situations where patients have to be carried by multiple providers in order to be covered by personal protective equipment. Thus, the personal protective equipment needs to be used by the ambulance provider as well as the patient in order to stop the prevention of infection to others. The ambulance then will need to be disinfected as well as the provisions inside the ambulance. And in dealing with those patients, the receiving facility, the healthcare facility, will need to be notified regards to the possible transportation of a patient with this virus. In essence, the healthcare facility can prepare with proper PPE, isolation, as well as perhaps notifying the CDC that they have received a patient based on this type of virus. Based on the circumstances I have mentioned above, it takes a collaborative effort as well as coordination in working alongside the hospitals and the healthcare industry, as well as those facilities that may be impacted by receiving this type of patient. It is necessary, again, depending on the type of outbreak, to create an incident command post, utilize the incident command system, and then create a unified command system in the event that this type of contamination will continue to spread in greater numbers.